In this video, we're going to be showing the restoration of a lower molar and an adjacent bicuspid, tooth number 2122 for US, and tooth number 36 and 35 in the universal codes. We're going to pick this video up at the point the preps have already been completed, the total etch has been complete. Rubber dam is in place, and all the matrices have been placed as well. We use a paleodent matrix system, the sectional matrices. I like them a lot. I think they're very easy to contour and adapt due to the anatomic shape. And keep in mind, when you're actually looking at these matrices, you'll notice that we've used the bitene rings. In this case, we've used 2 bitene rings to accomplish the separation that enables us to get the good, solid, tight contacts. The rubber dam here, bleeding control, very critical. I'll add one more thing here. When you do get any bleeding in these cases, I believe always using the hemodent clear and or any kind of a laser or an electrosurge can accomplish providing proper hemostasis, which you must have. What we're going to be doing in this case as well is picking this up now and understanding that the video that we're going to be seeing is shows some stained dentin. Caries indicator has already been placed in here just to provide the assurance that there's no active decay in place. So as we go ahead with this video, we're going to use a material here that is prefaced here in the bonding. We use a Danville microprime that provides the important antibacterial surface. It desensitizes. We air dry it, fantastic, followed by a Scotch Bond. Now the Scotch Bond is one of those, I think, 5th generation adhesive single bottle, and you'll notice we don't want a lot of pooling on this, so we're air drying this, and then that'll be followed by curing. Obviously any of the universal adhesives work very well. And following this, what we're going to be doing is we're going to be doing this critical step where we use a ball burnisher and we're burnishing all the adjacent contacts. Now, the necessity of burnishing contacts can't be overemphasized, so we do this in terms of just enhancing the anatomic shape. You can see the wedges that have been placed to also provide a little more separation, as well as using these paleodent rings. And so now we're ready to go, and we're going to use our adhesive, and here, not our adhesive, but we're going to be using our fill. I prefer in this case to use the SureFill SDR Flow. I really like this material. It wets beautifully. It's a bulk fill, self-leveling. I still like to help the adaptation in this case, and you'll see here I'm going to be using Explorer to tease this in. Very radio-opaque restorations, and I'm going to put a little bit of a disclaimer in here. You'll notice that when I was teasing this self-leveling bulk fill in, on the mesial surface of the molar, I was a little bit short. The reason I'm doing that is because my visual access was not great, because we had to allow the camera to come really close in here. And so now we've actually gone ahead and cured that. We're going to follow with a material here now. I love to use this Filtex Supreme. It's a great nano hybrid composite. I use the compules that are already put in a warmer. Has excellent handling, and with the warmer composite, they say it does enhance the cure of the composite. The handling of this material, I'll use a ball burnisher here. Sometimes I'll even wet the ball burnisher with a little bit of adhesive, probably a Scotch Bond, just to allow this to actually be manipulated. I'll then use a plastic filling instrument just to start to get my marginal ridges, remove any excess along the inclined planes. And then we will go ahead and we will cure this. Then again, probably just a little bit short on this, because visually I was doing some of this without seeing some of this, some of these sections. But we actually would go ahead here and we'd augment this at the end just to fill any voids that were created. The next step that we're going to be accomplishing here is we're going to be going ahead and removing the bitene ring on the back, just to allow us now to move to the bicuspid restoration. Then again, you'll see a little bit of stain internally closer to the buccal area. We're going ahead here and we're burnishing again up against the cured mesial surface of the molar. We burnish heavily that band on the bicuspid. We'll go ahead and we'll adapt our self-leveling SureFill Flow here. We'll be bringing the Explorer in once again to just to tease. We used a PFI here, just to tease the material down and just to make sure it adapts, and I'm happy with that. We will go ahead and we'll light this up for our initial cure. And now we will be going ahead and we will be adding the Filtex Supreme 3M product. Then again, you're going to see how nicely this is to pack. It doesn't stick, really nice to sculpt, and you'll see how this does not stick to this very clean new ball burnisher, or also sometimes, as I said, I will wet this to actually help the lack of sticking to the ball burnisher. You'll see how nicely isolated everything is here with the rubber dam. And we're going ahead and clearing along that marginal ridge. Just any excess just enhances our contouring polishing later. We go ahead at this point and we will cure this once again. And once that's accomplished, we'll go ahead and an important step here is that we remove the biting ring, the anterior biting ring, remove the wedges, and here's where we're actually going to peel back the sectional matrices a little bit. And the trick here is we peel these back to enable us to actually have some access with the curing light that will now go into the previously blocked out areas interproximally, especially at the gingival area. This just ensures the fact that there's no uncured resin in this area. Access to the light obviously is very important. And then once this is accomplished, you can't overcure these things. So here's an interesting thing. Removing these matrix bands, we roll them out. And if you notice the hemostat, which I used in this case, I just grab the one end of the band, I turn and roll and pull through. We don't want to pull up just in case there's any areas of marginal ridge. And you can even see in this how nice the contacts have been formed here, removing any wedges. And we're ready now to go ahead and to cure everywhere again. You can't overcure once again, as I say. And we'll be ready to start our polishing. So this is where we will actually cut the video off. Here you're going to see an E.T. Brasseler football polishing burr just to remove the initial bulk. And at this point we'll cut the video off. We're actually starting to run into some time with our video, but you'll see I'm following down the inclined planes when I'm polishing with a very feather light touch, so I'm not removing any enamel, just establishing the cavo surface margin. And at this point my assistant told me we're running out of battery, so we did stop this, and we'll pick this up just with a video of the final restoration, and we'll talk a little bit more about that. In this photograph here, we have the completed restoration of tooth number 22. Tooth number 35 would be the universal code. Now, preceding this, we showed the actual placement of the restorative material. So just to summarize, to pick up where we left off, the polishing of this is accomplished using, I like to use the ET6 and the ET12 polishing burrs. Prior to that, we always remove any flash using the Montana Jack scaler. Very important procedure here is that we're always getting it interproximally. We can't see the flash. The flash is a combination of the cured adhesive resin and also the bonding resin, and also any of the overlay, the overflash from the restorative material. That's a very important concept here. Now, just a note about when we polish these things, you want to go through all these steps with every tooth. I start with the ET6, which is a football-shaped Brasseler burr, removes any of the bulk, starts to establish where the margins are following the incisal, the occlusal, cuspal inclines. And then what we do is we then follow with a flame shape or a needle shaped ET6 burr to gain access to the interproximal, being very careful not to score any of the area at the cervical margins. You got to be very careful of this, maintaining the contact at all time. What we would then do is go ahead with our multi-fluted 12, fluted ET12, which provides a beautiful finish as well. We always finish them with the Brasseler Dialite Ultra Fine Polishing Cup. It also can be adapted interproximally in the embrasures, which does help, and making sure you're flossing very well. Now, another note here is I don't know if you've had one of these restorations done, but providing anatomy, color, you could do this kind of thing, but I will tell you, when you start to create some interproximal grooves, the patient won't like it. They'll make a comment about it doesn't feel as smooth with the tongue. So I've really, from going to doing very anatomical restorations, years ago, I decided to do exactly what we needed to do, was please what the patient's tongue was telling them. So you end up with a very smooth surface, great finish on these, and there again, you're looking at the final tooth that'll show a very nice tight contact, good contouring, good marginal ridges, and should be something that you should be proud to show when you're intraoral photograph. That's going to create the wow that you're looking for.